Very good morning to you all. Welcome to today's podcast. I am Dr. Abhishek from Parkwest Dental in Coimbatore. So I thought I'll talk to you about a very simple topic today, dealing with your daily oral hygiene and maintenance. It's nothing but brushing and flossing. So all of us brush their teeth. There is no doubt in that. Of all ages, from the age of 1.5 up to the age of 100, all of us are brushing our teeth. But are we doing it right? And how do we do it? Is there a better way? Let us just explore in this small tete-a-tete. So, coming to a toothpaste. A toothpaste is nothing but a mixture of various chemicals. There is a soap, there is a detergent, there is a surfactant, there is fluoride, there is flavor, there is sweetener, there is color. So all these put together form a toothpaste. Toothpaste are also made for various uses. Like how anything is made for different uses. You have foods for different uses. You have foods for children. You have foods for adults. You have foods for improving nutrition for pregnant ladies. The same way, toothpaste are also made for different needs. There are daily use toothpaste. There are medicated toothpaste. There are toothpaste meant for sensitivity. Toothpaste meant for repairing damaged teeth. Okay. So how do you choose your toothpaste? Is the core of this small session. So you would have seen a lot of toothpaste which focus on whitening. They say that use this and you're going to get whiter teeth. Whitening toothpaste or toothpaste which make your teeth shine. So how does a toothpaste make a tooth shine? Is because of its abrasives used. So if you go in for a whitening toothpaste or a lot of these gel based toothpaste like close up or total whitening and things like that, you have abrasive particles which are larger and which are at a more concentration in the toothpaste. So naturally or obviously, when you brush your teeth with these abrasives, the tooth becomes more whiter and your smile becomes more brighter. So unless you really need to use these pastes, you should avoid them, because as you are polishing your paste with these abrasives, you also should remember that on a daily basis you are abusing your enamel. So the next level are normal daily use toothpaste. An example of this is the old Pepsodent, the old Colgate, the basic white Colgate, Pepsodent, Cibaca, Promise, all the age-old toothpaste which were used for all these decades. Those are the conventional daily use toothpaste. So many people ask me, what toothpaste do I use? So if everything is fine and you just want toothpaste to do a normal cleaning each day, for adult I'm talking about, use a normal paste. The age-old paste, the same brand names that you've been using from your childhood are more than enough. Then if you want little more extra benefits, there is something called like Colgate Total is there, which has got some more flavor, some more additives which make sure that your mouth is fresher for some more time. Then coming to medicated or sensitivity toothpaste. So I have seen a lot of patients who come here, especially the older patients, the seniors, who say that we've been using Sensorine for years. So what does Sensorine do? Basically, it seals off the microscopic openings in the tooth which lead to sensitivity. So once these openings are sealed, then naturally sensitivity is brought down and the patient feels more comfortable. The second way is by kind of numbing these small nerves within the teeth. So again, your patient loses that sensitivity. But even then, these are all chemicals which are put in to make this happens, to make sensitivity relieved until you meet the dentist. So any sensitivity toothpaste or any of these toothpastes are suggested for say 3 to 6 weeks. Beyond that, if your sensitivity is persisting or you are still not feeling comfortable to eat or to drink your regular foods, it is time to go to a dentist. Don't depend on these as a solution to solve these problems. You can just mask them for some time, or you can just check if this is a very small issue. But if it is still persisting, you have to visit a dentist. Don't stick with these toothpaste for a long period of time. Then we come to tooth repairing toothpaste. For example, there is Amflor, there is a lot of these good pastes which are coming out now, which have got certain ingredients, basically a lot of calcium and phosphates, which remineralize the tooth. Now, what happens in, especially in our quality of life, is that we eat a lot of refined foods, which and we have a lot of parafunctional habits which tend to demineralize the teeth. So when we use toothpaste like this, or when we use something like tooth mousse, this is tooth mousse. So this is something which is applied on your tooth after your brushing, and since it's got a high concentration of calcium and phosphates, it gets reabsorbed back into the teeth and builds back the teeth again. It's like reinforcing the concrete in your house. So these pastes are also not long-term paste. They are meant to do their job in a specific period of time, beyond which, if you're not getting the relief, you have to visit your dentist again. So those are all medicated toothpaste, or toothpaste which are they have added some other medicine to give some sort of a relief or to some sort of a benefit. So I am not against herbal toothpaste, but if you are using herbal toothpaste, you also should understand what each herb or each ingredient in it is doing. So since I am not an Ayurveda person, I cannot comment about what these things are doing. I cannot comment what Tulsi does to your tooth. I cannot comment on what Amla does to your tooth. But I know what these things are doing, because they are evidence based. They are on hundreds of research papers for so many years all over the world. So being an evidence based person, I prefer to use something which is studied, which is researched, which is proven for so many years, and it is there internationally. It's not localized to a certain country or to a certain place. So using herbal toothpaste are your choice. I have no personal opinion on them, but if it is me, I would like you to use a normal toothpaste available in the off the shelf, off the counter. If you feel that herbal pastes are better for you, do use them, but again, understand them and then you use them. Now we are coming to something called the dental floss. So does everyone need to floss their teeth? The answer is no. Only if you feel that between your teeth your brush is not able to clean properly. Suppose you have got gaps between all your teeth, you don't need to use a floss. But some people who have got nice tight contact between the teeth, that your bristles of your brush are not able to go inside and clean the corners or the edges of these teeth correctly, then you have to use a floss. Also, floss is advised in places where people who have got large teeth, where there are a lot of gums, where they're not able to clean certain small corners, small edges, small sides of the teeth, which is only possible with a thin floss, then floss is suggested. So for about 75% of the population only needs a floss. There is about 25% of the population who don't need a floss. So there's no point in wasting your time doing flossing if you don't need it. So again, you visit your dentist, find out if you need flossing, ask your dentist which is the best floss available for his condition, for his teeth, for his dentition, what floss is the best choice. So how do you use a floss? Let me give you a small demonstration. So considering these are your teeth, you have gums, you have teeth, you have brushed your teeth perfectly, very good. So where does the floss come in? We are using a Oral-B Essential Floss today. It's one of the thinnest flosses that are available, and they are also waxed. So you take out certain amount of floss, decent amount, and just snip it away. Wrap one end of the floss around your finger, the other end around your left hand finger. Keep one finger having more of the spool and another finger just the tip of the floss. So once you have done that, it's very slippery because it's very thin and waxed, so you have to hold on tight. So how to use a floss? Never push the floss straight down into your gums like that. Always gently slide it inside, because if you push your floss down, that's a mistake which many of us make. It will only injure the gums and it will cause bleeding. Very gently you just slide the floss inside and pull it out. Slide the floss inside, pull it out. The pulling out must be a little forceful and a little fast. That is how you basically are scooping out the dirt and bringing it up. So again, I'll just show you one more time. Put in the floss, slide it in gently and scoop it up. Slide it in gently and scoop it up. Now, after you have used a certain area of the floss, you just wind that once around your finger and let loose the other side, so that you always have some fresh floss available for the next tooth. So like this, you have to clean between each and every teeth, and once you're done, just discard the floss away. Never reuse your floss, because your floss will have a lot of infected debris, it will have a lot of germs on it. So once your floss is used for one time, throw it away. So this is a good floss which I suggest. It's called Oral-B Essential. But again, I'm reminding you, please visit your dentist and find out what floss is suggested in your condition. Thank you.